Hello students, welcome to short concept video session on medico apps. Today I'll be discussing with you all a term which you might have read a lot of times and you must have heard also in your dentistry. The term is ankyloglossia. Yes, this is an important term because you should know what exactly is this ankyloglossia and what are the features with which the patient will be present to us in our clinics or in our hospitals. So let's today understand this important term, that is ankyloglossia. But before that, I want you to subscribe my YouTube channel so that whenever I discuss such kind of important short concepts, or even if I'll be discussing some MCQs for your PG preparation, you'll be notified with all of those important dental topics. So let's start today's discussion by first subscribing my channel, and after that we will understand this ankyloglossia term. So, whenever you hear or you read this word ankyloglossia, what do you understand by that? So, ankyloglossia, if you break this term, basically has glossia in it. So, glossia itself is a tongue term. Okay, it means tongue. Okay, so ankyloglossia, the other name for ankyloglossia is basically tongue tie. So, I hope you are getting a little bit of hint if I'm using a term tongue tie. Tongue, you all know, that is our tongue which is present in our oral cavity. That is the organ which is one of the most important organs of our body. And tie means something which is tied to something. Now, what is tied in this condition? So let's start. What exactly is ankyloglossia and how you will define it in your examination. So, ankyloglossia is basically a congenital anomaly of the tongue. That means it is a developmental anomaly which is present since the time of the birth. Now, what exactly happens in this condition of ankyloglossia? So, in this condition, the patient is present with short and thick lingual frenum. Now, what exactly is this lingual frenum? You all know that because you are reading it from the first year itself. Yes, the landmarks which are present in our mandible. So, what exactly is lingual frenum? So, let me just for your reference, I want to mention that this is the mandible. This is a mandibular cast which you might have seen lot of times from day one. Okay, so here, if I say that there's a frenum which is present at the buccal region, okay, that is the buccal frenum. Here in the front, which is connecting our lip with the gums below, they are called as labial frenum. And here comes the lingual frenum, which is present. If you see, that is a tongue which is present just below the tongue. There's a frenum which is present, and that is what you call it as lingual frenum. Now, usually the lingual frenum in normal patients are long and thin, but in a patient with ankyloglossia condition, the lingual frenum is present short and thick, and because of that short and thick lingual frenum, there will be limitation of the tongue movement. Now, how would be a limitation to the tongue movement? So for that, you need to refer this image. Now, how? Because as you can see, the lingual frenum which is present in the lingual region, this is your tongue. Okay, and this is the frenum I am discussing about, which I have just mentioned here, that there will be a tongue and here will be the lingual frenum. Now, this lingual frenum, doesn't it seem something abnormal? Yes, it is abnormal. So, this lingual frenum is thick and short, and because of that, the tongue is not able to freely move. So, there will be restricted tongue movement, and that condition is known as ankyloglossia. So I hope you have understood this word of ankyloglossia and why it is called as tongue tie, because the tongue is almost tied to this frenum, and because of this tying condition, the movement of the tongue is restricted. Now, do you think that due to this limitation of the tongue movement, there will be certain presentations with which the patient will be present? Yes, there are certain clinical features with which the patient will be present to us. So, let's start and understand what are the clinical features with which the patient will be present. So, firstly, let me just tell you that though it's a congenital anomaly, it is more seen in male child than in a female child. The other important clinical features is that in a newborn baby, the breastfeeding is the only way where the nutrition can go in the child or in the newborn. Now, if there is tongue tie, there will be trouble breastfeeding the patient because there won't be any proper tongue movement. So the suckling movement of the newborn will be affected. As the child grows a little bit, after 6 months, 7 months, when he or she starts having a food or something, so there will be even trouble swallowing that because of the tongue movement. Another important point and another important feature with which the patient might come, the patient's parents might come to you, is the difficulty in speaking, because tongue plays a major role in our speaking. So there can be speech impairment in certain terms, and overall also there might be difficulty in speaking. And lastly, if you have a tongue tie, if not to that certain limit of limited tongue movement, the patient might have a midline mandibular diastema, and this is the midline diastema which I am discussing here. So the anterior incisors, the central incisors in the mandible will be in a diastema state. Okay, there will be space between the two central incisors, and that is what you call it as diastema. So all these are important clinical features with which the patient will be present to us, and we can easily say that this condition is ankyloglossia. And the only treatment which you can go ahead is the frenectomy. Yes. Okay. The cutting or the surgical excision of this frenum is known as frenectomy, and that is the treatment part. So I hope you have understood this ankyloglossia term with the clinical features with which it will be present, because you need to just correlate the condition with the clinical features, that what all features with which the patient might be present if the tongue is tied to the frenum below. So I hope you have understood this topic. Now, before ending this topic, I want you to subscribe my YouTube channel, that is the BDS Express YouTube channel. And in case you want daily important updates on dental topics, I want you to join our exclusive WhatsApp group. And the link for that is www.medicoapps.org/group. The link of this group is also given in the description of this video. So kindly join this group, because you'll get all the important discussions, all important cards, the material which is related to our dental topics, and it will be really beneficial for you in the theoretical exam as well as for PG preparation and even in the Viva questions. So thank you for now. Good day, good luck.